Hello. Uh-huh. Uh-huh. I'll be right there. We got a case. Hi, my name is Jordan Junk. I am a first-year PT Midwestern University student. I just got a call about somebody who has had an acute flare-up of gout over at their work. So let's see what technology that they have in order to help her out. But first, let me tell you about gout. Hi guys, welcome to my office, and thank you so much on coming to my little lecture about gout. Now, before we go see that patient, let's go and learn what gout really is all about. So, what is gout? Gout is going to be a crystal-like rheumatic disease that is going to be caused by too much or an excess amount of accumulation of uric acid. And for us who like genetics, you can also be predisposed to have a lot of uric acid coded within your DNA that can be exacerbated by meat, seafood, and alcohol, as well as certain medications. And if you have a lack, also if you don't have this pre-genetic disposition, if you have a lack of this uricase enzyme that's going to help uric acid be excreted through the kidneys, you can also get gout in that way. And not only that, but if your kidneys have poor excretion within them or your kidneys aren't functioning properly, then you can get gout that way as well. So, what are some symptoms of gout? Gout, when someone comes into the clinic and they present themselves and you see a joint and it's red, it's hot, it's swollen, and it looks very, very painful, it could be a sign of gout. Not only that, but if they complain of night pain and if the joint especially looks infected, you're going to want to send them out in order to have a fluid biopsy on that. And for chronic gout goers, they are going to have white bumps that are going to be underneath the skin, and they are going to be called the tophils. So patients are going to have tophils in their joints. So that's how you're going to know if you have a patient with chronic signs of gout. So how is this going to be diagnosed if you get them a fluid biopsy, right? So you know that there is an accumulation of crystal deposits, which I told you before, called tophi, around the joint. This is going to be that's what causes that excruciating pain, because those crystals are what bothering the tendon and the joint. They are digging into those muscles, they're digging into those ligaments, and they're tearing everything up. Now, if you have a lab setting and you go and get a fluid biopsy, they know if you have crystal-induced gout due to the urate levels within your body. Males, if it's greater than 7, and in females, if it's greater than 6, they have gout. So, there are going to be many solutions for gout, especially for acute. For acute, you can take NSAIDs, corticosteroids, as well as keeping ice on it, elevation, and have it rest. You want to make sure that you keep the swelling down in gout in order to help promote that healing process. Now, for chronic gout, they're going to be taking a lot of this medication right here, as well as there can also be surgical interventions in order to get out those crystals. And for those crystals, remember, they are sharp and pointy. So if they have long-term chronic gout, they're going to have very limited movement within the PT clinic or when you go and see them. And that is because their joints are going to be torn up. They're going to have a lot of pain and swelling and constant pain because of those crystals digging into those joints and those soft tissues. So I hope you learned a little bit, and here's where I got all of my information as well as the lecture that we were given in PT school. So let's go check out my patient. Hey, I'm glad you made it. So the patient that I got a call about the acute flare-up of gout, it's in both of her wrists. I mean, how painful, especially because she's an office worker and has to do emails and projects and everything over the computer. But it's painful for her to type. And when it's painful for her to type, it's just going to add and increase the pain if she continues so. We want to promote rest. And in order to do that, we have to come up with other ways of her to do her job efficiently and effectively. Luckily for us, it's the modern era, and we all know what that means. Smart computers. So smart computers are able to actually have voice recognition on the laptop in order to help us do voice typing. And also lucky for us, she has a smart computer that has voice typing. So let me show you how to use voice typing in order for us to show the patient, okay? So all you have to do in order to set up voice typing, in order to type your email, is this little magic square here and H. And then all you have to do is just click the text box and this little microphone, and you are all set. Period. Voice typing is fairly new in today's technology, comma. It is easy to set up and is fairly useful to the patient in order for them to get their work done. So, as you can see, that is one tech-savvy way in order to help with acute bouts of wrist gout. Now, this trick is not for everyone. There are going to be people who are not as tech-savvy and don't know how to use it, and there are people that are not going to be comfortable using it either. So, there are other ways to help reduce wrist gout. How you can do this is you roll up 2 towels. You place them where your wrists are going to go. That way there's going to be decreased pressure on the wrists, and that way not only is there going to be decreased pressure, you are now elevating your wrist to help reduce the swelling. And nobody likes water near their computer. However, now we can put ice on our wrists because we have towels underneath. So smart. So, easier to type, less pressure, and ice. Everything that we need to do to decrease pain and swelling and to help get you back to the best you can be at work. I hope you guys learned a lot, because I certainly did. All right, have a good one. I'll see you guys later.